Celiac disease can occur at any age, from young to old. It can be triggered at any point in time in someone's life.
Dr. Claire Jansen-Nodell is a gastroenterologist with Cleveland Clinic's Celiac Disease Program.
Celiac disease is a chronic or lifelong illness of the small intestine. So when a person with celiac disease eats gluten, it triggers an immune response, which causes antibodies to form and a cascade of inflammatory cells which attack the lining of the small intestine.
Symptoms of celiac disease can be intestinal or affect other parts of the body.
Some of them are classical, which means signs or symptoms of malabsorption, like diarrhea, weight loss, anemia, and poor growth in children. And some of the symptoms are non-classical, ones that can be from the intestinal system or extraintestinal. Intestinal symptoms would be abdominal pain, constipation, bloating. Extraintestinal symptoms would be things like abnormally high liver tests, skin rash, joint pain, and thin or broken bones.
Celiac disease is hereditary.
So there are two things that are necessary for a person to develop celiac disease. One is the genetic predisposition, and the other is ingesting the trigger or eating gluten in the diet. We sometimes do genetic testing in people who have a family history of celiac disease, for example, or patients who are already following a gluten-free diet. But it's important that if you or someone you know is worried about celiac disease, that you don't stop or reduce gluten on your own, because this can affect your test results and make it harder for you and your doctor to determine if you have celiac disease.
How is celiac disease diagnosed?
We use a blood test and a tissue sample, or a biopsy taken during an upper endoscopy, where we take a small piece of the small intestine, look at it under a microscope to check for that damage from gluten. There's no medication or cure for celiac disease. The only available treatment is the gluten-free diet. When a patient with celiac disease stops eating gluten, this allows the cells in the small intestine a chance to heal and return to normal. We don't recommend gluten-free foods for people who don't have a medical necessity or celiac disease in order to follow the gluten-free diet. This is because gluten-free foods can have higher salt, fat, and sugar content than the gluten-containing counterparts.
Registered dietitians and doctors work together in Cleveland Clinic's Celiac Disease Program to help patients manage their condition.
Usually it's diagnosed in the 30s to 40s, and like most autoimmune diseases, there's a female predominance. A majority of patients who are diagnosed with celiac disease are women.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.